Hello, everyone, and good morning, in US and good evening in Asia and Europe. So we are going to be talking about a topic which I think is very near and dear to all of us, is insomnia. I know I've been having a lot of problems sleeping lately for the last 1 year or so, but that's the topic we have been discussing with Vaidya Sujatha Reddy, who is an Ayurvedic doctor and a mental health counselor. So she is going to tell us how Ayurveda can help with the sleeping issues. I am Amita from NourishDoc, a platform for natural and holistic therapies. I would like to introduce to all of you Vaidya Sujatha Reddy, who has been a mental health counselor and an Ayurvedic doctor for the last 25 plus years, and she's joining me live from Colorado. Welcome, Dr. Sujatha.
Namaste. Thank you, Amita. It's a pleasure. Thank you for hosting me on Facebook Live.
Okay, so this is a beautiful, beautiful slide that Dr. Sujatha put together. Insomnia is called what? Anidra? Could you explain us a little bit?
Yeah. So insomnia management in Ayurveda is a topic for today. Insomnia itself is a symptom. It is not the underlying issue. I would say it expresses as insomnia. There are other underlying conditions that express insomnia. So in Ayurveda, it is called anidra. Nidra is sleep, anidra is not sleeping. So that's how it goes. And we can move to the next slide.
Yeah, so let's talk about different types of insomnia, right? That's the next slide that we have here.
So there are different types of insomnia. One, we can categorize them into three: transient insomnia, acute or short-term insomnia, and chronic insomnia. So with transient insomnia, it just lasts less than a week, and it results from any environmental changes, climatic changes, travel, and stress. As you all know, I just flew back from India, and I did have transient insomnia due to jet lag and the time difference. And I was waking up like 2 in the morning and going and can't sleep. So that is something that is natural. Our natural biorhythm is affected, and due to that we go through the transient insomnia. And then there is the acute or short-term insomnia. This lasts less than a month, and of course it results from any ongoing stress and illness. Suppose you experience, you're healthy and suddenly you fall sick, with any diagnosed diseases for any reason, you cannot sleep sometimes. It could be a chest congestion. It could be something that is coming in the way of your normal biorhythm again. So this is a short-term insomnia. And then there is a chronic insomnia, which lasts more than a month, and it results from long-term health problems, stress and anxiety. Suppose there is, chronic pain, and, there is some discomfort in your abdomen, heartburn. There are so many situations that, we chronically can relate to sometimes, we see with our patients, and they are not able to sleep. So these are the three types of insomnia that we can categorize, anidra. Let's see, let's go to the next slide. Let's see what causes insomnia. So one of the things, we have to closely pay attention to is what we are doing. In Ayurveda, we know, according to the basic Ayurvedic principles, that like increases like, and opposites imbalance our doshas. So when we are saying, opposites balance our doshas. Sorry about that. So when we are saying, looking at our Ayurvedic principles, our body is always adjusting to the external environment, and it is trying to keep the balance. It is called homeostasis, right? The dosha balance, whether it is with environment, whether it is situations, whether it is, climatic conditions, anything that you want to think of. Our body is always adjusting to keep it at a certain temperature, keep it at a certain balance, and keep it at a certain rhythm, so it can function normally. So now, when we disrupt that normal, functions and normal homeostasis, like by excessively, say, for example, substance abuse with smoking or excessive caffeine or alcohol or using recreational drugs, what it does to our system, it throws us off. It throws our physiology off, and it is confused with its physiological functions, the normal way what it's supposed to do. It may be forced to excessively perform in ways that it is not meant to. So with the disruption of circadian rhythm, shift workers, they work in the night shifts or second shifts or first shifts. Again, they are not in with the flow of the night and day rhythm in the night and day, and so that causes a disrupted routine and schedules. So working long hours in the night, it affects our sleep, and like literally bombarding our eyes or our sense organs with external environmental factors like computer screens or some things like that that disturbs our circadian rhythm. And the uncomfortable sleep environment. Say you're not in your bed, you go someplace else to a friend's place or camping or somewhere, and you can't sleep. So that is another factor. And we are also looking at any psychiatric and neurological conditions like anxiety, depression, post-traumatic stress disorder, and restless leg syndrome. These are some of the factors that can affect our sleep. And especially with anxiety, your mind keeps running, you cannot calm down. And sometimes there's a fear that you will not be able to sleep. And so just that fear can cause, insomnia. And if there is, for example, in this COVID situation, people are, operating out of fear, and fear is a big factor for insomnia. Depression, when things are not going well, and depression is coming from the past issues. When we start thinking in our mind about the past of what we are experiencing, whether it is sadness or whether it is abandonment or anything, like that, then, we cannot sleep at night. So what we are doing is using the bed as a place to run our mind. And that is going completely against the principle of sleep. And post-traumatic stress, any external trauma, then you're having a fear of the trauma happening again and again. And so that is preventing our mind to calm down. And what it does is it just activates our, we are going to a overactive sympathetic hyperarousal. And that, when that happens, then sleep is sabotaged. For us to sleep, we have to be in a parasympathetic nervous system needs to be activated, and it's not the sympathetic nervous system. And so that needs to be addressed. And, looking at the restless leg syndrome, I mean, women especially, going through menopause or, just before period, we experience a lot of physiological distress and hormonal fluctuations that can affect sleep too. We're not able to eat. I mean, we're not able to sleep in the night, just before having period or, during menopause, and all that is with hormonal imbalances and cravings. All of these things happen, eating in the night, that we're not supposed to eat. So biological factors, again, age, the biological clock, inactive lifestyle and activities is a cause of insomnia and the degeneration of health. So there's a lot of these factors that affect, and each one of these factors can be dealt with in detail about how we can address it and we can correct our sleep rhythm. So let's move on to the next slide.
So you're talking about sleep apnea, heartburn. I think. Do you want to expand on this?
So sleep apnea. Right. So what is sleep apnea, right? Sleep apnea is obstructed airways that, we cannot breathe and take in oxygen, and we stop breathing in the night. And when that happens, and suddenly when we stop breathing, we are awakened suddenly, after maybe a few seconds or even a minute. So we are experiencing sort of a hypoxia in our system, and we are never going into deep sleep. And when that happens, you don't feel rested when you wake up. You have disrupted sleep, difficulty sleeping and staying asleep. So these are all the factors. And why does sleep apnea happen? Again, there's a lot of other factors, with obesity, with, any other thyroid issues, some of these conditions can cause sleep apnea. Chronic illnesses like congestive heart failure or COPD, pulmonary dysfunction, heartburn, prostate problems, they have to wake up and go to the bathroom every time. And so, it's inconvenient and for them to get a whole stretch of sleep at night. Menopause, I did talk about this before, that women do experience insomnia, with menopause, suffering from again, sleepless nights, hot flashes, so many other symptoms that they go through. And diabetes is also one of the factors. Arthritis, pain in the body and joints, causes insomnia too. Hyperthyroidism, I think I touched about that a little bit. With hyperthyroidism, your mind is also very active and you're not able to calm down and sleep. And long-term use of medications, like decongestants, bronchodilators, beta blockers, and sleep meds chronically used can also disrupt your sleep. Excessive engagement with TV, phone, and computer screens. So what does this do? I mean, these days, we are by default engaging with the screens a lot. What does that do? Okay, if we engage with them during the daytime, that's okay. But then if we are engaging into them late in the night, what happens? It disrupts the melatonin secretion in our mind, in our brain, so, and that is melatonin secretion starts when the sun sets. And that's when Ayurveda, we have what is called as dinacharya and rutucharya and ratricharya, for a reason, because we are the micro of the macro. We are all interconnected to the universal principles in Ayurveda. And what is out in the macro is also within every cell in our body. So we are designed to be in tune with the nature. So the impairment of melatonin production, which is secreted by the pineal gland, it regulates the sleep-wake cycle. Now, what this does, according to Ayurveda, it results in the imbalance of all the three doshas. And with the three doshas, the Vata, Pitta, Kapha doshas, there's specific type of doshas, sub-doshas that are affected. So the Tarpaka Kapha, the Sadhaka Pitta, and the Pranavayu is affected in insomnia. And this Tarpaka Kapha can be related to our melatonin production, so if there is depleted melatonin, then, our sleep is affected. Next slide. Now, let's look at what are some of the clinical, symptoms or features that we see when a person goes through not sleeping well at night. They are fatigued, they're not refreshed in the morning, inability to sleep despite being tired, then they experience daytime drowsiness, irritability, and difficulty concentrating, and they have impaired ability to perform normal activities, and they have body aches and heaviness. It's almost like, you have a hangover next day. You need a certain amount of sleep depending on your constitution. When you don't get that, it accumulates. When you start counting the number of hours you slept every night and you don't add up to it in a week. For example, if you need, say, 8 hours of sleep at night, 56 hours a week is necessary, so if you're sleeping, say, 5 hours or 6 hours, then, your lack of 15, 20 hours. And normally what people do is they try to catch up on the weekend, they take naps during the day, and these are all very unhealthy practices that does not allow the mind to be reset and connected to sleep when it needs to sleep. Next slide. Now, how do we manage this? One of the ways is to prevent it. So Madhura Rasa, which is something sweet, like, and buffalo milk. This causes our kapha, Tarpaka kapha, to increase, and it also causes melatonin production. So that will help us sleep. And an active mental and physical life. Now, it's not recommended that you be very active mentally and physically just an hour or two before you go to bed. But at least 3-4 hours before, your bedtime, it's okay to exercise a little bit if you have not, because the vata time according to Ayurveda is between 2 to 6. So that is a very active time. So those active times, we are okay to be active in our mind and body. But then after that, 6 p.m., it is winding down time. It is a kapha kala. So we have to entertain that, the kapha time. Uh, there's yoga and meditation, of course, that will activate the parasympathetic nervous system, and we are more in our body than in our mind when we do yoga. And of course, meditation, there is a lot of research done how it affects our mind and body, and how we can be in the homeostasis and sleep well. Another process of body work is the Shirobhyanga and then Padabhyanga. Shirobhyanga, of course, day to day, it is what we could do is just dab a little bit of sesame oil on our scalp region, and also massage sesame oil in our feet, soles of our feet now before we go to bed. If you're having chronic insomnia, then yes, the Shirodhara is recommended, that you can get the Shirodhara treatment, and of course the appropriate Ayurvedic medicines to address the issues. But day to day, just application of a little oil on your scalp and the sole massage with sesame oil or ashwagandha bala oil is advised. Practicing sleep hygiene, which means avoiding stimulants like caffeine, alcohol, etc., in the evenings. What that does is it robs you or sabotages your deep sleep, and it keeps you awake. Yes, alcohol a little bit, wine is, they recommend, but what I have seen in my experience, people tend to have more than, a glass, habitually. They have 2 to 3 glasses, which research has shown that it robs you of deep sleep. And caffeine stays in your system for a very long time, like 4 to 6 hours. So if you're having sleep issues, it's highly recommended that you don't have any caffeinated products after 3 p.m. or 2 p.m. during the day. And avoiding incompatible foods. Heavy meals at night is one of the factors. In Ayurveda, we recommend eating 3 hours before our bedtime, so that our food needs to be fully digested, and we should not be eating heavy in the evening because our metabolic rate is not that high. And stress. Now, we do come from work, we work during the day. If things have not gone well, if we don't like our job, and if we have too much to do, coming home again to another shift of work. So all these factors, increase insomnia and help us stay wired in our mind and not be able to relax. And it's not like we are leaving our work at the door and stepping into the house. We are carrying that load, carrying that with us, and even to bed. Following dinacharya, rutucharya, and ratricharya according to Ayurveda is so important. And keeping in mind the dosha dominance during the day and night is very important. And if any of you want to know what dinacharya, rutucharya, and ratricharya means, I would say, it's a lot of information is available on the web. Dinacharya is like a daily routine. What is your wake up time to sleep time, what you need to do, when you need to eat, how you need to live your life. Very well explained in Ayurveda. And Ritucharya, during some of the seasons, like this is winter, right? We have long nights and short days. We tend to sleep more during this winter times, which is kind of natural and okay to do. And it depends upon where you live too. Like in Northern America, we have extreme weather conditions. And, people who are in the tropical areas, they're pretty balanced with their day and night routines. So keep that in mind. The desha and the kala are very important. Ratricharya is important to know what to do at night, how to wind down, and how to follow sleep hygiene and not to engage in anything stimulating at night. So, there's a age-old practice that we do is when we sit at the dinner table, we tend to pray, or we tend to offer our food to, celestial beings or gods, what we call. And why is that? We just have to sit mindfully and eat. When we become present in what we do, then our mind stops being active. We come more into our body. Our parasympathetic nervous system is active. And when we activate that, our hunger, our digestive juices flow, and everything is timed in Ayurveda. Everything goes very well according to how it needs to be, whether it's digestion, absorption, or assimilation. Okay. Now, how do we manage medically? Another thing is by removing the causes, the etiological factors, and practicing sleep hygiene, which we call as nidana parivarjana. And panchakarma procedures like the Abhyanga and Shirodhara that we talked about. Abhyanga, our skin is a great organ, sense organ, that when we do regular oil massages, take a shower and just dab, or, some oil massages, light oil massage on your skin, your nervous system completely relaxes. Herbs like ashwagandha, jatamamsi, brahmi, and mandukaparni are used. And there are a lot of Ayurvedic medicinal preparations, that are made out of these herbs, along with oils that can be used for insomnia. And of course, the yogic practices of yoga nidra, which is pretty popular these days, is highly recommended to take it to a deeper state of consciousness, to be a deeper state of relaxed consciousness. That way you can get out of your mind. Pranayama is another one to balance the Ida and Pingala, that is also one of the ways that we can activate our parasympathetic nervous system and calm our mind down. Now, counseling is highly recommended. Big people who suffer from anxiety and depression and who are not able to sleep, their anxiety and depression, the issues need to be addressed. A lot of these patients that I have seen have high anxiety and have a fear of sleeping, fear that they will not sleep. Just that fear of not sleeping and ruminating over that is going to cause them not to sleep. And so teaching them how to not care about it, and how to practice sleep hygiene, and how to not think in bed and worry in bed. You don't worry in bed. You don't engage your mind in bed. You don't watch TV in bed. So these are all simple things. You don't eat in bed. You don't eat sugar, desserts, like close to bedtime. So these are some of the, very simple techniques that can be taught. Normally, what I end up also doing is giving them a sleep diary to log into the times when they sleep and when they're awake and what they're experiencing, just to see where they are and, what they're doing. And then I also do cognitive behavioral therapy with sleep restriction therapy to correct their rhythm of sleep at night. If they don't have any issues, and then we have to address their mental health issues that are comorbidities to sleep. So, and again, healthy food habits according to Ayurvedic routine and practices of when to eat and how to eat is very helpful. So that's a little bit brief about Ayurveda and insomnia. I will be happy to answer any questions if any of you have any. I can see Vipin is on Facebook. So yeah, thanks.
So, Dr. Sujatha, thank you so much. I think this is really a very succinct presentation for someone who's having problems. But you did mention about the buffalo milk, the milk part, right? So what about people? There's so much information about the milk. Don't take milk, lactose intolerance. Sorry.
Right.
So what are your thoughts on that?
So buffalo milk itself, the guna, the properties according to Ayurveda, is very heavy. It lulls the mind, so it increases tarpaka kapha in the body. Now, if with people, it doesn't, if it is not available, cow's milk is also good. Now, if they have lactose, intolerance, then they could use almond milk, and then add to it nutmeg, and something like that, other alternatives other than just buffalo milk.
Okay. And then, so you would recommend someone to follow dinacharya, like a so dinacharya for someone who's having problems with the sleeping would be a little bit different, right? In the sense you wake up and you do, like Shirodhara, of course, has a lot of research. Abhyanga and Shirodhara, you can get a lot of research in PubMed. But do you recommend like a self massage in the mornings and at night with sesame oil, or warm it, or infuse it with herbs? Just talk to us a little bit on a self-care part of it.
Yeah, so if people are experiencing insomnia and not able to sleep, first of all, like I said, and especially if they are having issues with anxiety or depression, one thing is to practice sleep hygiene no matter what. The issues we can address later, but getting in tune to practice the sleep hygiene is very important. Like when we look at what they do before bedtime, what are they doing, how much TV are they watching, what is their bedtime, correcting those little things is very important. At night, eating dinner 3 hours before. Okay, you cannot sleep, then have a bath. Normally I tell them to just, take a hot bath and, rub some ashwagandha bala oil or sesame oil on your body. And then, you can put some on your scalp and then, rub them on your soles. And when you lay in bed, you do not think in bed, you do not engage in any gadgets. Normally I tell them, listen to them soothing music, while you sleep, and then just do yoga nidra or, some pranayama, some engage in that a little bit before you go to bed.
Okay. So since you are a mental health counselor, and I think sleep, a lot of times sleep is also associated with negative thoughts that don't get out of your mind, right? So, and most of us experience that, whether we had a bad day or a bad job, or stuck in a bad relationship, or have some childhood trauma, a lot of things, right? All of us go through that. So what are your recommendations as a mental health counselor, not as an Ayurvedic, but mental health counselor?
Right. So we get stuck in the negative loop of things, right? So when that means your mind is running, and your mind is running in a very negative way. Now, whether it is negative or positive, sometimes if you're too happy, you can't sleep either, you know.
Yeah.
So you're too excited about something, something is great is happening to you tomorrow, you're not able to sleep, even that is there. So that,
Yes.
whether it is negative or positive, it is how you're engaging your mind, how your mind is running all the time. Now, again, being mindful about that and winding down so is very important. When there is either fear or excitement, either one can cause insomnia. So, again, being mindful, going not to go into extremes of anything. It depends. In this age of, for example, I had a patient who developed insomnia mainly because of she had a fear that her husband would leave her for another woman. Even though everything was fine in her life, her husband loved her and all that, because of her childhood trauma of abandonment, that kind of carries on. And that gets triggered, when there is even the slightest harmless thing is viewed by your brain, which stores your previous memories, in your amygdala, in the lower part of your brain, that gets activated because it stores, right? It's a memory, it stores, and then it suddenly relates to, oh, I know this has happened before. You be very careful now. This is going to happen to you. That's your mind telling you. Your mind is trying to tell you you're in danger. We go into a survival fight or flight reflex and freeze. We do three things. We either, when our mind or body, when we are experiencing something is going to be dangerous to us, there are only three things that happens. Either we fight or we flight or we freeze if if we become helpless, right? So at that time is when you are on a sympathetic hyperarousal. When you're on a sympathetic hyperarousal, there is no talking you out of it. No matter what you say, your mind is not going to let your guard down. It is going to, tell you you're in danger. You got to do what you got to do. So it's not going to let you sleep. You're going to be attacked. Don't sleep. You got to be very careful. You have to, safeguard yourself. Something is going to attack you. Something's going to happen to you. These are the type of thoughts that come in the way of not being normal. So that's when counseling comes. So a lot of the times I do use techniques to calm mostly their fear, and by calming the nervous system, I use murmurs to help with that. I use Ayurvedic therapies. I use chanting. I use working with their thought processes, having them write down their thoughts and what is using a mood log, what their mood, how to break their irrational thinking, and what are the emotions that go with the irrational thoughts, and do they have any experiences, pleasant experiences in life that I can actually anchor, and then have them use that experience to counteract what they're experiencing right now. So, there's a lot of things that we do in mental health counseling when it comes to dealing with anxiety, depression, and insomnia, and post-trauma, traumatic stress. And that can be as young as, when you are under 7 years old, when you do not have any of the defense mechanisms, and when the things are happening to you, when you don't have that independent, that will to fight against anything. So,
well, thank you. Yeah, no, I think this is very useful to all the viewers who've been watching, and we just or will watch later. Let us know, if you're having problems with sleeping, and these little tricks that or preventive mechanism that Dr. Sujatha has been talking about will help you. With that, anything else that you would like to add, Dr. Sujatha? We wrap up.
Well, the most important thing is that to be in the rhythm of nature, in your body and in your mind, and not to add anything into your system that is not natural. So just recognizing that is very helpful, and being mindful with everything that you do. So.
Well, thank you. Thank you so much for being with us. Thank you to all the viewers. Please help us share these sessions and follow us, and let us know your feedback, how we are doing, and let us know any questions you have. So with that, I'd like to wrap up this session. Go with a natural life, natural way of holistic lifestyle. That's what we are talking about. Thank you so much, and have a great day, everyone. Bye-bye.
Thank you.